You do those things and I guarantee you, at the very least, your outbreaks are going to decrease by half. First of all, let's talk about why maskne happens to begin with. Naturally, your skin produces a ton of oil, lots of dead skin cells that are sitting on the surface of the tissue, and just kind of environmental pollutants that are clogging the pores. And then you're adding a mask on top of it. Now you're creating this humidity from the breath, and all of that combined, if you don't have a good skincare program, if you're not chemically exfoliating your skin regularly or doing things to help promote that exfoliation regularly, you're going to probably run into some cystic type acne, some of those deep, painful undergrounders. What I want to do today is maybe give you guys some tips. A, how to prevent the maskne, how to address it when you have it. I have some products that I really love here. The mask that you want to wear is the fresh, clean, new one. So I'm not so sure about which mask is the best one to wear. I know I use a copper mesh mask, which is supposed to be antimicrobial. I don't really know how truly effective that is. I want to really attribute the fact that I haven't been having the flares that I had in the beginning of the pandemic to my skincare program and the fact that I'm changing my mask every single day. So that's like number one is you have to wear a fresh mask every single day. If you're using the ones that you wash, I would just get like maybe 20 of them, throw them in the wash once a week, and then just use a fresh one every single time. Number two is you have to wash your face twice a day. I know that seems really basic to some of you, but some people have really, really big lives and they just can't commit to that all the time. So maybe they only do it once a day. So the second easiest thing to do is wash your face twice a day. If you're an oily skin type, you're going to want to use, like I really love the SkinCeuticals Glycolic Renewal Cleanser, and it's a gel cleanser and it's got both glycolic and phytic acid. It's got an 8% glycolic value in it. It's going to be a little bit on the drier side, but during the summer seasons where we're a little bit oilier, especially with the masks, I find there's a lot more kind of greasiness to my skin, so I'm not afraid to use this at least 3 times a week. Second one down from that would be the Exfoliating Cleanser by Zeo, and it's got these like cool little blue beads in them that give you a little bit of an exfoliating component, but it's for most normal to oily type skin, so most people can tolerate this without getting too dry. The other thing that you can always use is the Zeo Gentle Cleanser, and that's safe literally for all skin types, dry, oily, and everything in between. My second favorite thing is the Argentin 23 Colloidal Silver. This is a nicer bottle. Colloidal Silver is a naturally occurring antimicrobial, and this is what's going to be your toner. So there were a lot of questions about which toner should I use. I'm not a huge fan of toners. I do like the Obagi, the old Obagi medical toner, and the Zeo calming toner, but for the purpose of this talk and maskne and acne in general, I would just recommend doing sprays of silver all over the face and neck wherever you're experiencing maskne, and you do that twice a day. Typically this is used for immune support, so on the back of the bottle it'll say to like spray underneath the tongue, but my recommendation is obviously to spray on the face where you're experiencing the acne. So you can use a gauze to wipe down the spray, or you could just let it, air dry, doesn't matter. The next thing on the list, if you are experiencing cysty type acne, I'm going to recommend something a little bit more aggressive, like the 10% glycolic and 2% salicylic acid pads that we have here. This is going to be really great at helping to dry out some of those buggers and kind of help to also exfoliate some of the dead skin that's sitting on the surface, which is also kind of contributing to some of these clogs. So I usually tell patients to cut these in half. You don't need to use the entire thing, and just spot treat over the areas where you're experiencing the clogs or the cysts rather. If you're not as affected by cysts, but maybe it's just like a bunch of whiteheads, you can still use the glycol pads. They're going to be a little bit drier, but Zeo also makes the exfoliating pads, the complexion renewal pads, and that's not as strong, but still has some acids in it. They're going to help to kind of dry up some of this excess oil production and also help to kind of promote some skin brightening. This is all in when you're experiencing a breakout. This is what you should be doing. And then of course you can scale some of this back once you're clear by just using the silver and of course the wash. The last thing to go on in the morning is your sunscreen. So absolutely, so this is like the big one, no moisturizers, guys, no moisturizers. I don't care if you have acneic skin or you don't have acneic skin, moisturizer is not your friend. It is potentiating more oil production, which is what is inherently giving rise to your acne. So my 2 favorite sunscreens right now are going to be, well, it's always the Ulta MD SPF 46, and I like the 46 because it's specifically designed for acne and rosacea type skin, and it is a a moisturizing sunscreen, so it's a 2-in-1. You don't have to lop on a sunscreen on top of a moisturizer. The second one that I really love is this really cool brand new one by SkinCeuticals. It's a 30 SPF as well and super hydrating. So either one of these are safe for acneic skin types. Everyone should be wearing at least a 30 or higher, especially when you're going to be using Retin-A, and that's going to be your evening routine. So that's the daytime face wash, silver, pads. Also, if you want to add in a polish, this is really nice by Zio. Also, like maybe 2 or 3 times a week, just to kind of like get rid of some of that superficial dead skin, any blackheads that you have, and it smells amazing, and you just really feel clean afterwards. That would go in between the wash and the silver. Evening time, very similar. You're gonna do the face washes again, then you're gonna do the silver again, and then in the evening time, you're gonna use a hydrating serum. I really like the Metacell Renewal B3. It's niacinamide, which is anti-inflammatory. The Hydrate B5 gel is also very good, because these things are not gonna, they're not gonna goop you up. They're not gonna force your oil glands to make more oil. They're just gonna help your cells hold on to hydration. The last thing to go on would be either a Retin-A or a retinol. So if you're someone like me who has thick, oily, sebaceous skin, I have a history of cystic type acne, you're going to want to use one of these guys. Either the tretinoin 0.1% or the tretinoin 0.05%. What is this doing? Tretinoin opens up the cell walls, it allows the oil to escape, and these clogs that you're experiencing are going to be purged. So initially, you may notice that your skin, perhaps you're getting whiteheads that you didn't have before, and all of a sudden, it's looking a little bit worse before it gets better, but that's because your skin is beginning to purge all of the gunk that's causing this stuff in the first place. I use a 0.1%. Alternatively, if you're someone who hasn't used Retin-A, this is a little bit too much too soon, you want to go a little bit slower, or perhaps you have a drier skin type and you're still breaking out, then I'm going to recommend a retinol. This being the less aggressive one. So for my whitehead people, blackhead people, not really cysty, you can definitely go with the Alpha Ret or Alpha Ret Intensive. The only difference between these two is the glycolic acid strength, 10% versus an 18%. The retinol is the same. And then the other one is by Zio, the Wrinkle and Texture Repair. The Wrinkle and Texture Repair is kind of amazing because it has other properties. It's got 0.5% retinol, but it has other properties that also help to chemically exfoliate the skin that aren't retinoid based. So it's going to be tolerable, but also, being really active and doing what it's supposed to be doing. The one thing I did want to mention is the Silmarin CF that was specifically designed for acneic skin types. And it's a vitamin C serum that has a salicylic acid component in it as well. So this is going to also help to prevent, if you want to do something that's anti-aging, antioxidant, which you definitely want to do while you're experiencing any acne. This is a really nice product, and it doesn't feel like it's gooping up the skin. It doesn't feel oily. If you guys are using CE ferulic and you are acneic, I'm going to discourage you from doing that because the E oil is not helping you. So either the Floritin CF or this is a newer product that we're carrying, the Silmarin CF. Last thing I want to mention, you guys were asking about masks. So what's the best mask to use? I think you guys were referring specifically to the actual physical mask, which I've already covered. What I want to discuss is the sulfur face mask that I recommend, especially when you're experiencing severe outbreaks. So the sulfur really helps to kind of dry out some of the superficial dead skin and helps to kind of expel the pores of the clogs, which is what's giving rise to the acne. And sulfur can be really drying to some of the excess oil production that your pores are creating. So these are some of the things that you can do. This you can put on for 20 minutes nightly if you wanted to. Sulfur's like super safe for all skin types. This is a great product. It's a 10% sulfur, which is quite high and super effective. And you can put it on the body as well if you're experiencing it on the neck or on the chest. That's kind of the spiel. Basically, you have to wash your face twice a day. You gotta wear a clean mask. You gotta up your skincare game. You do those things and I guarantee you, at the very least, your outbreaks are gonna decrease by half. And the longer you continue to do these things, your skin should begin to clear up as mine did. I guess that's gonna be it. If you guys have any other questions I have to run, please put them in the comments below. I'd be happy to answer them in another call, another video, or just over stories. All right.